Good morning, everyone. I am Khrisyah Gabe Oliver, and I'm an undergraduate nursing student from Dr. Yanga's Colleges Incorporated in the Philippines. And today, I'll present my research study entitled Reawakening Public Support, Implications of Desensitization and COVID-19 to the Risk Perception and Health Behavior. I'll start. So, in the year 2019, an unexpected viral infection brought fear and damaging repercussions in different countries. And it was a frightening time for all of us. But what if that fear becomes boring and your emotional response becomes blunted over time? Today, I'm going to show you how being desensitized to COVID-19 can lead to negative consequences and what actions can we impose to resensitize the public towards progressive change. I will never forget the first time that I rode a roller coaster. My hands were cold, my body was shaking, I was trembling in fear. But after the second, third, and fourth time that I did it, I realized it was not that bad. Being on a roller coaster in numerous times made my fear less strongly than before. That can also explain the concept of desensitization. Desensitization is a psychological process wherein an individual is exposed to a fear-provoking situation, and over time, that fear becomes less strongly than before. In relation to COVID-19, yes, it was a fearful situation for all of us, but as time goes by, that fear becomes gentle. We realized it was not that bad. According to the recent studies of Stevens and others, they suggest that COVID-19 related news can no longer stimulate a response. In the beginning of the pandemic, we considered this type of news as a relevant information for us not to acquire the disease and to keep ourselves updated and monitor the disruptions that this pandemic brought. However, these type of news can no longer stimulate fear and anxiety among readers. And because that loss of fear and anxiety, it can manifest through changes in health behavior and risk perception. And desensitized individual may no longer feel personally at risk in acquiring the disease. And through that, it can result to non-compliance with the health protocols. And because of that, it can affect the efforts to mitigate the virus and the overall implementation of the minimum health standards. Others may say that COVID-19 is long over, that we should deal with it. Unfortunately, countries like USA, COVID-19 still kills more than 3,500 people each week. And globally, nearly 4.5 million new cases and 32,000 deaths were reported in the last 28 days. So that was from February 6 to March 5, 2023. So the objectives of the study is, we have two objectives. The first one is to develop a model that represents the implications of desensitization to the risk perception and health behavior of our participants. And the second objective is to develop a resensitization plan that could reinvigorate public support towards progressive change. And also it will be helpful for the authorities to take care the desensitized public. So for the methodology, we utilized explanatory sequential mixed methods design. So these kind of research design, it has two phases. In the phase one of the study, we conduct quantitative data gathering. The researchers develop a tool that can assess if a person is desensitized to COVID-19 because one of the reasons why treatments on COVID-19 pays little attention to COVID-19 desensitization is the lack of appropriate psychometric instrument, so that developing a brief and a valid instrument that could assess if an individual is desensitized, it will be helpful for the authorities to formulate and implement a program that could benefit the desensitized public. And the tool was validated by psychometrician and health experts. And for the internal consistency, for the internal consistency of the study, we used Cronbach alpha with a value of 0.70 and was considered satisfactory to conduct the study. So this is the scale that we made. It is a 5-point Likert scale. So these are the items included in the questionnaire. So for example, for the question number 1, I believe I have less probability of acquiring COVID-19. So these items are based on the literatures that we've read, and also it is based on what changes can we see in the desensitized public. And the tool was administered to the sample between the age of 21 to 59 years old. We chose this age range because they are the most vulnerable and exposed, especially in the Philippines. These age range from 21 to 59 years old. They're the one who is allowed to go out to their homes. So they have more exposure to the COVID-19 or to the threats of COVID-19. And the results were then analyzed and interpreted. So that was the first phase of the study. We will move on to the second phase of the study, which is the qualitative part of the study. So we conducted a semi-structured interview with a subset of desensitized public, and the narratives were then analyzed using thematic analysis. So this became our basis for the resensitization plan. So for the results, so these is the result in the quantitative part of our study. So the questionnaire result showed that 64.75% of the participants were desensitized. So that is more than half of our participants. We administered the questionnaire in a total of 404 participants, and after having statistical analysis, 64.75% of our participants were desensitized. Now for the findings, this is the qualitative result of our study. So through the interview, we formulated 2 emergent themes. So the first theme is the interlocking triggers of COVID-19 desensitization, while the second theme is the interplaying factors affecting COVID-19 response. So the first theme focuses on the causes of COVID-19 desensitization, while the second theme focuses on the effects of COVID-19 desensitization to the implementation of the minimum health standards. So this is the model that we've made through the interviews, or through the narratives that we've gathered. So I'll explain first the first theme, which is the possible causes of COVID-19 desensitization. So we have here 2 possible causes. The first one is exposure to perceived obstacle. Exposure to perceived obstacle, it means that these are the stressors, hardships, and challenges that our participants experience for a long period of time. Being exposed to lifestyle disruptions, to economic breakdown, and to fearsome COVID-19 related news affects their fear and emotions. It makes their fear and emotions to shut down. Having exacerbated feelings of stress, it causes the individual to have blunted response to the pandemic, and it also became their way of coping to the unprecedented challenges during this crisis. The second possible cause is embracing reality. So desensitized individuals tend to accept that this is our new reality, that we cannot do anything about it. Unfortunately, the pandemic does not appear as the problem that we can easily or quickly solve, and most of us is not in the position to solve it. And when life is not exactly as we want it to be, it is easier for us to turn our minds towards acceptance. The second theme discusses the interplaying factors affecting COVID-19 response. So these are the possible effects of desensitization to the minimum health standards. First is we've seen that the sensitized public has demotivation in performing health protocols. Second is regressed fear and risk perception, and lack of emotional response. The motivation in performing health protocols, they tend to engage more in mass gathering. They don't often wear masks in public places. They neglect to have booster shots, and they don't adhere to social distancing protocols. Regressed fear and risk perception, they have declined fear, decreased perception of seriousness of the disease, and decreased perception of susceptibility in acquiring COVID-19. And the last effect is lack of emotional response. They are apathetic towards COVID-19 related news. They have declined compassion towards emerging COVID-19 cases, and they lost empathy, or their empathy is on decline. So we can see here that these effects has a direct association to the transmission rate, and it can amplify the damage of the disease itself. So the question is, how can we solve it, or what plan can we propose to solve it, or to solve it, or to manage the desensitized public? So through that, we made a COVID-19 resensitization plan. The goal of this plan is to hopefully reinvigorate public support towards taking action in the pandemic, and also to motivate them to perform minimum health standards. So it has 5 steps. First is to listen and understand people. Second is assess of level of desensitization. Third is to implement harm reduction approach. Fourth is be creative and innovative. Fifth is evaluation. I'll explain one by one. So first is listen and understand people. By listening and understanding people who are experiencing desensitization, the authorities could prevent giving judgmental accusations and biases. In understanding the desensitized public, the drivers and the barriers impacting their ability to take up protective behavior, it will allow the authorities to implement specific programs that are particular to their needs. Also, the authorities should also consider that desensitization is a normal response to the daunting realities of this pandemic. It also became their survival response, and it does not correlate to insensitiveness and ignorance. Authorities should be empathic, should be understanding above judgment and humiliation. Second step is to assess the level of desensitization. So the authorities could use the proposed or the developed questionnaire of the researchers to assess the level of desensitization among the public, because by assessing the level of desensitization, they could recognize what population group and what geographic location is most desensitized. Through that, they could implement or statistically implement effective risk communication strategies. Third is to implement harm reduction approach. So by allowing the people to live and do their daily function with reduced risk, they tend to engage more in performing health protocols. Also, this could decrease the transmission rate without disrupting their everyday living. And the strategy should not only be focused on effective vaccine, transmission cure rate, and infection control, but authorities should also consider the economic breakdown, the economic well-being, the lifestyle, and the overall, and also the emotional distress of the desensitized public. Fourth is be creative and innovative. By implementing creative and innovative approach in terms of communicating to a desensitized public, they will likely to engage themselves more to act and respond. Fifth is evaluation. So the authorities could use the developed questionnaire of the researchers to evaluate the level of desensitization among the public, and by reevaluating the level of desensitization, authorities could recognize or could alter and adjust what went wrong so that they could implement better plans. So the pandemic leave an indelible mark in our history. Now it's time to know what went wrong so that we can do better in future health crises. Our study is not a direct portal to completely eradicate COVID-19, but I hope it can be an impetus to get the discussion started. Also, the developer sensitization plan can be used to different health crises. there are a lot of countries now who have successful stories in terms of responding to the pandemic. And day by day, new cases and transmission rate are constantly decreasing. But desensitization cannot only happen in our present situation or during this pandemic, because desensitization could also happen in other health issues or health crises. And through that, our study could help the authorities to prepare and also to take into consideration that desensitization is real and it is happening. Thank you.